Sometimes my mom lets me ride my bike to Mr. Johnson's house to play catch. I'm the best outfielder he knows. I think he used to be a baseball player or something a long time ago.
Can Mr. Johnson come up to play catch?
Honey, I'm sorry, but he's not really up to playing catch today.
I hope the doctors make them all better real soon.
Palliative care is basically bringing the same expertise that we bring to hospice patients to patients who aren't in hospice.
Most of the patients don't know what palliative care is. Palliative care is for people who are still on active therapy, may have curable disease, treatable symptoms, and aren't at end of life. There are a lot of people with chronic illnesses who aren't well served by the usual medical care. And so palliative care really fills a gap for a lot of people.
Heart disease and lung disease and liver disease are all things that can benefit from both hospice care or early on, before hospice is appropriate, to get palliative care involved.
Well, I think a lot of people, when they first come to us, they feel like they're kind of stuck, like they've tried this and they've tried that and nothing seems to be working. And so if you can get them out of that stuck place by helping with just a few symptoms, a little equipment, maybe some physical therapy or something else that they didn't know they could get.
I'll see patients in the ICU, or I'll see patients on telemetry, or on just a regular medical surge floor. But we'll see patients in nursing homes, we'll see patients in assisted living centers, in their own homes, and then we also do have an office setting where we would like to see patients as well.
We help coordinate all different services that might be available to them in the community. So we might coordinate with therapists, we help coordinate equipment, medications, and just sort of give a little extra attention to the quality of life.
Another large part of what we do is be able to talk about big picture type things, goals of treatment, what is beneficial for me given what's going on with me, being able to sometimes have those difficult discussions with people. One of the things that we very much like to try to achieve is to have family members in harmony and in unison with what's happening. To be able to offer an opportunity to have everybody gather, to be able to talk about their concerns, to be able to talk about their fears. As a team, we'll have a discussion about patients, and we do this every other week. We sit down and we go through our patients, and we have a chance to discuss what we're doing for them.
When we're talking to a primary care physician, we want them to know that we aren't taking over the patient. We're just adding additional support, and we're adding additional support to the patient, the family, and helping their office, because a lot of times these patients are calling in frequently and needing a lot of help.
People, I think, for a long time, hospice care was felt to be that's only for people who are in their very last days of life who have cancer. And I think people are starting to understand that that can really be a benefit that's available to them much earlier in the course of their disease and in much different illnesses.
So it's nice to feel that within just a few days, you can get people feeling better.
If we get into a situation where the patient has really done very well, then we'll sometimes say it's time for us to disengage and to discharge the patient.